Hello, I am Professor Alexey Karpenko, co-founder and partner of EmCell Company, General Director of EmCell since 1994 till 2001. EmCell is a world leader in clinical fetal stem cell transplantations since 1994. I would be glad to tell you what is unique about EmCell and why EmCell therapy is the most potent method among stem cell treatments. About 20 years ago, EmCell created the first safe and efficient technology for clinical fetal stem cell transplantations. It was investigated, officially approved in Ukraine, and patented for multiple clinical use worldwide. First US patent was granted to EmCell in 1998, before the stem cell boom in America started. What is EmCell therapy? During about 20 years, we practiced modern methods of treatment for particular diseases and enriched them with transplantations of fetal stem cells of different kinds in various combinations and sequences. We call such sophisticated complex treatment EmCell therapy. Clinical technology of EmCell therapy is the most valuable knowledge and a growing point of clinical stem cell transplantology today. EmCell therapy is an efficient and safe holistic treatment for great variety of diseases. Moreover, EmCell therapy opens a new page in systemic prophylaxis of cancer, heart diseases, aging problems, and more. Advantages of fetal stem cells. Fetal stem cells have two major advantages over the rest of stem cells. First, they have the strongest curative potential, and second, they are accepted by recipients with no rejection. Foreign adult stem cells are rejected by recipients. They demand suppression or even eradication of recipient's immunity. Adult stem cells of own body, collected and cultivated, have moderate curative capacity in comparison with fetal stem cells. Embryonic stem cells resulting from artificial in vitro fertilization are still too far from practical clinical use. History of the breakthrough. You may know that the first Nobel Prize for treatment using stem cells was granted in 1990. The source of those stem cells was human bone marrow. But it is well known that the most potent stem cells are located in fetuses. Fetal stem cells give rise to all kinds of cells in the human body. Transplantation of fetal stem cells is the most promising branch of cell transplantology. Aborted fetal tissue is legal for therapeutic use in the European community since 1986, in the United States since 1993. European ethical guidelines on the use of human embryonic and fetal tissue transplantation provide ethical rules on the use of aborted tissue for clinical transplantology. In 70s and 80s, there was an international scientific race for development of effective and safe clinical method for fetal stem cell transplantation, also known as fetal liver transplantation. The race involved about 20 countries. Scientific results were published in the first-class journals. There were observed some very good individual results, but average statistic was poor. This indicated high potential of the fetal stem cells and absence of a technology to use them. After 20 years of international efforts, no proper technology was created and this clinical branch was abandoned. Professor Alexander Smikadub from National Medical University in Kyiv, Ukraine, succeeded to invent a clinical method for efficient, safe and convenient fetal stem cell transplantation. First international publication on the matter appeared in 1992 in London. First EmCell patents were officially filed in 1993. Patent offices of the United States, European Community and Russia noted top-class novelty of the inventions. The discovery of Professor Alexander Smikadub was supported by National Medical University. In 1994, the university-based clinic, Cell Therapy Clinic EmCell, Kyiv, Ukraine, was founded. EmCell has performed so far about 7,000 clinical fetal stem cell transplantations. This is the largest experience in the world. New methods of treatment were elaborated in cooperation with leading medical research institutes and universities in Ukraine. New methods were duly approved by the Ministry of Health and National Academy of Medical Science of Ukraine. EmCell has contributed to about 40 major international congresses and conferences, published about 100 scientific articles, has been granted 18 patents in the United States, European Community, Ukraine and Russia. Thus far, patients and doctors from 72 countries have visited EmCell. To understand EmCell therapy, please consider just several crucial features of fetal stem cells. First, fetal stem cells have no own curative effects, but they can give rise to any specialized cell posterity which is needed for the sick body of a recipient. Development of the posterity needed in the particular case is requested and guided by the body regulation of a recipient. As a result, a few kinds of rather universal stem cells can be a cure for a great variety of diseases. This is a new situation in medicine. Second, fetal stem cells and their posterity are not rejected by recipients. They do not need selection of a matching donor. They do not need eradication or suppression of recipient's immunity. On the contrary, they vigorously restore immunity and as a result cure and prevent infections and tumors. They correct immunity and thus cure autoimmune diseases. Third, transplanted fetal stem cells give no clinical effects in a healthy man. They cannot exist where tissues and functions of a recipient's body are strong and healthy. Only weak, ailing, or aging body gives them a chance to survive and flourish. So, fetal stem cells seek for damaged or faded tissues as a favorable space for living. They find defects in the body of a recipient, settle and function there, which means most fine revealing and treatment of these defects. Fetal stem cells perform such diagnostic and curative procedure in a holistic way towards the whole human body. Such curative agent, self-guided and directed by recipient's needs, acting in a holistic way with universal potency, such curative agent is unique in the history of medicine. And one more. The procedure of fetal stem cell transplantation is very simple and usually consists of subcutaneous injections and intravenous infusions. Curative effects of fetal stem cells. Curative effects of fetal stem cells encompass all levels of human body and all kinds of tissues and functions. In particular, recovery of volition and mentality, recovery of hematopoiesis and immune competence, restoring of trophism in all tissues and organs, including revascularization of heart muscle, brain tissue, liver, kidney, skin, rehabilitation of degenerated or damaged tissues and functions, recovery of behavior, activity, physical force, mental power, appearance, normalization of homeostasis in all kinds of metabolism, improvement of weakened functions in aging organs, harmonization of mood, vigor, libido, appetite, weight, self-confidence, and vital force. Fetal stem cells and their posterity may stay in the recipient's body from a few months to lifelong period. Consider please two examples. In case of a transplantation after chemotherapy, as soon as own immunity of a patient regains competence, it eliminates the cells of transplant. Another example. After transplantation in case of aplastic anemia, with no own hematopoiesis and immunity, stem cells of a transplant install new hematopoiesis in a patient and support it for many years with no decline. Great many of chronic diseases demand more than one course of EmCell therapy. The treatment may be repeated when clinical effects would decrease. Clinical effects of fetal stem cell transplantations usually last from several months to many years. The most beneficial clinical use of fetal stem cell transplantations. First, cancer. Fetal stem cells allow rapid restoring of hematopoiesis after chemotherapy. Within about a week, even in cases of deep anemia. This ensures survival, reduces infectious and hemorrhagic complications, and accelerates recovery of general condition. Chemotherapy with the support of fetal stem cell transplantations may be more aggressive, therefore more efficient, and at the same time much safer. Fetal stem cell transplantation within weeks before chemotherapy or 1-3 days after makes a chemotherapy course much easier, with less risk and shorter in time. Second, juvenile diabetes. Diagnosis of juvenile diabetes when first established means that autoimmune aggression has already destroyed about 80% of pancreatic beta cells. The rest beta cells could prevent development of full-range diabetes, but they would also perish during several months, because modern drugs cannot cease autoimmune attack. Modern treatment does not stop further destruction of the remaining beta cells. Fetal stem cells are the only known modern means that can interrupt autoimmune aggression. They may save, partly repair the rest beta cells, and prevent development of full-scale diabetes. EmCell therapy may ameliorate the cause of diabetes and change the destiny of a child. Time is crucial. Such option exists only 1-3 months after revealing juvenile diabetes. Autoimmune diseases. EmCell therapy is efficient treatment for all kinds of autoimmune diseases: multiple sclerosis, rheumatoid arthritis, ulcerative colitis, etc. Nowadays, only fetal stem cells can stop or at least retard development of autoimmune aggression. Contrary to hormones, they do not suppress immunity and do not produce severe side effects and complications. In some way, they change the attitude of immunity towards own attacked cells and thus resolve autoimmune conflict. We observe such results regularly. The underlying mechanisms are still not known. We call for scientific cooperation in research on this phenomenon. Aging. Fetal stem cells have no peer in treatment and prophylaxis the problems of aging, such as development of cancer, heart diseases and brain disorders, low quality of vision, hearing, moving, poor condition of skin, bones and muscles, lack of vital forces, mental and physical capacity, fading of general state and appearance. Stem cells treat all such problems individually in a holistic way. Improvement of skin quality is a pleasant side effect while treating real problems of aging. Transplanted fetal stem cells reveal and treat disorders on the early stages. This allows deeper recovery and longer support of health. We would appreciate clinical cooperation in research of holistic anti-aging treatment and prophylaxis with the use of fetal stem cells. Autism. Our recent experience has proved that fetal stem cells help autistic children. We have observed encouraging progress in behavior, speech, attention, self-control, comprehension, curiosity, eye contact, shared conversations, controlling body functions, improving of learning at school. It seems that in autism, a chronic inflammation against some unknown infectious agent supports chronic physiological stress in the body. This chronic stress affects free development of many fine functions: mental functions, social behavior, digestive functions, blood circulation, intestinal microflora control, etc. Efficiency of fetal stem cells in treating autism may be attributed to reinforcement of patients' immunity and to huge potential for recovery of damaged tissues and functions. EmCell is officially licensed by the state as a bank of stem cell transplants. EmCell produces and stores fetal stem transplants in its own biotechnological department. EmCell applies due measures and rigorous control to ensure high quality and infectious safety of transplants. Transplants are made with the use of aborted tissue donated by women who apply to hospitals for appropriate medical service and sign informed consent for donation. Donation is free and anonymous. Women receive no money from their donation and cannot indicate for whom transplant should be used. Such international ethical rules allow avoiding stimulation of abortions. Welcome to EmCell. The simple procedure of fetal stem cell transplantations allow outpatient treatment. Patients usually stay in hotels or apartments in the city. Transportation to the airport and to the city is provided by EmCell. Pricing policy of EmCell is rather modest. You may compare with some clinics where they transplant adult stem cells. At the same time, the curative effects of fetal stem cells are much stronger, more systemic and long-lasting. You may also note that EmCell is the pioneer, oldest and the most experienced fetal stem cell therapy clinic in the world. EmCell is lucky to have knowledgeable, experienced and caring personnel which would be happy to help you. For more details, please visit my website emcellinternational.net. Do not hesitate to apply with a request. request@emcellinternational.net. I would gladly provide you with a fair advice. I wish you health. Take care.